I've lived in 6 states.
Right.
I literally have to go to 6 different states, 6 different health systems to get my medical record. I mean, that's literally probably taking 20 hours out of my life to collect that information and send it over to my insurance carrier just to get a life insurance policy. Let's hit some of the links to see if there's. So David Chow posted a link to the 2018 agreement between MIB and Epic. Margarita Kolezov, and this is the hardest part of this, is reading people's names, asked, is this reciprocated to the patients? Will they get access to their own information too? That's an interesting question. We created a way to share a significant portion of the medical record with MIB and New York Life. You would think that sharing it with the patient wouldn't require that much additional programming, at least as much additional programming as we were led to believe in the interoperability debate that would have been required to share it with the patient. I mean, if we create this mechanism to share that information over there, in theory, I mean, am I thinking right or am I off base here? In theory, couldn't you just use that same code and tweak it a little bit, put some sort of security and identity framework around it and share that information with the patient directly?
I mean, it's the patient's medical record, right? So they should have access to probably all the elements that are going to go over there, I would think, already, one way or another. I'm sure the mechanics of what's being sent over through interoperability is different than what a patient could ingest. But like you said,
yeah, I don't want to let common sense and logic to really cloud our thinking at this point. But it would seem to me that if you're building it for one mechanism, you can easily, if your programmers are any good, you're using reusable code and blocks and those kinds of things. It should be easy to do.